Welcome to Get Moving TV. I'm Dr. Chris Landon and I serve as your host. Here in Ventura we have educational resources both for patients, parents, and professionals. We have an incredible art community. Today we're going to meet with Suzanne Fischetti and talk a little bit about the educational resources we have available. We have this community access to, or COPD access to community health, tell us a little bit about the educational things that we're trying to do. And tell us about yourself, Suzanne.
Well, we're talking about the CATCH program, which is education for COPD patients. My particular specialty today is on medications for COPD patients and how to take them, why to take them, all of the different reasons why you should do it correctly. And I am a respiratory therapist. I've been a therapist for 37 years. And I'm with the California Society for Respiratory Care, the CSRC of California. And I am the past president of our local region.
Well, very good. Well, I see quite a few drugs up here, and I know we've got boxes and boxes, so these are just the different kinds of inhalers. Could you just maybe pick up a couple of the inhalers and talk about how they're different? And so let's get started.
Oh, yes. Well, the usual ones that people know about are just the little ones that you squeeze, and most people just go like that. And we would like people to use them a little more appropriately so that they get more medication. Medication is expensive, so why not get the most bang for your buck? Mm-hmm. And we suggest, if you don't have a chamber, to hold it a little bit away from your mouth, just a little bit, and squeeze and breathe at the same time. Start your breath first. Breathe all the way in, all the way down, and hold it for at least 10 seconds. That allows the medication to hit the parts of your lung way down deep where your bronchospasm would be. Now, we also have inhalers of lots of different kinds, but they all fit into a chamber. There's a hole on the end of it, and there's many, many, many different types of chambers. Many different organizations sell these things. There's many different types. We highly suggest that you use the chamber. Always shake your medication before you use it because it has to mix with the propellant, or you lose 25 to 35% of your medication right off the bat if you don't shake it. If you don't use a chamber, this will give you 2 to 3 times more medication into your lungs if you use a chamber with it. So, I mean, how many inhalers can you buy? 3 times the inhalers, how much they cost. So we highly suggest that you use a chamber so that you get 2 to 3 times more medication. And then you can just put it in your mouth, exhale all the way, put it in your mouth, then squeeze, then inhale. You can start inhaling, but the good thing about this is that the medication goes into the chamber and stays there so that when you're ready to take a breath, you can get that medication all the way down into your lungs.
It takes about 1.5 minutes, it stays in there, and there's a little one-way valve, so even if you're blowing out, having a hard time coordinating.
And people do have a hard time coordinating. I see people all the time who either they take the breath in before they even squeeze it because they just can't coordinate the hand and the mouth. They just can't do it. They breathe in before they squeeze.
Well, how about some of these other devices?
Well, then you have the dry powder ones, and they're completely different. You use them completely different. They're a completely different animal entirely. This is one that's really common, that you see all the time. And probably everybody knows how to do that. They also know how to set it. And what they don't know is that you have to breathe in really fast and really hard. If you don't breathe in really fast and really hard, the powder stays inside the machine and you don't get it. So even if you do it twice, you're better off than just kind of giving it a half-hearted one. But you also have to breathe all the way down and hold your breath for at least 10 seconds. If you can't do that, If you are unable to hold your breath and to suck it all the way down into your lungs, maybe you shouldn't be using this at all. Another problem is if you're feeling good, you can use it, but if you're having an exacerbation and things aren't going too well with your lungs, and maybe you wind up in the hospital, that is not a very good time to be using one of these, and maybe they need to give you a Symbicort or something like that that has a similar kind of medication in it that is also can be used with a chamber so that you can get the medication down into your lungs. Because if you can't get this medication out, it won't help you. And if the doctor thinks that you're getting this medication and doesn't understand why you're not getting better, you have a problem. And he doesn't even know that you're not getting the medication. So
Now, a lot of these have counters on them as well, so you know how many doses are left.
yes, yes. That is also a big problem that people have. That's huge, as a matter of fact. When they have a counter on the back, you know when you're running out, you can get a refill. But if you don't have a clue, and you can't tell by shaking it, by feeling it, there was an old way that people used to put them in water, and depending on how
Full,
it
half
sank,
full, quarter
yes.
full, empty. Yes.
Well, they're saying don't do that anymore.
Yeah,
For
powders are
one
different.
thing, the propellant weighs quite a bit. And if you just have propellant in it and it doesn't have any medication, you may think that you're getting the medication and you're not.
Well, I see a toilet paper roll there. What's that all about?
Well, back in the old days, they knew that it was really hard to get this into your lungs and that people had a hard time getting organized with it. And so they would put it to their mouth and they would squeeze it, and it would act a lot like a chamber. And in places where they can't afford a chamber, or you're out in a rural area and you don't have much you can do, sometimes a paper towel roll is pretty good for getting that in there.
And then before we leave there, we want to show people what we don't want them to have to see.
We do not want you to have to see this. That is the truth. This is what paramedics use. They can hook it up and put a breathing treatment in line, but what this is a CPAP machine. Now, people have heard of CPAP machines because a lot of people use them at home, and they recognize the mask that goes along with the CPAP, but this is a rescue CPAP. This is something that you put on your face, they put this over, they strap it on you really good and tight. When you can't breathe, this is the most beautiful thing you could possibly see. All of a sudden, you can breathe. Now, people might be scared when they see this. They might feel like, a little claustrophobic when they put it on your face, but as soon as you feel that you can breathe, it's a wonderful feeling. So don't be afraid when you see the paramedics come at you with one of these things, because this is a beautiful, wonderful thing, and it'll get you to the hospital where you can get the appropriate care.
Suzanne, well, thank you so much. I know we'll be seeing more of you in some educational videos. Thank you for taking your time with a meter dose inhaler, the dry powdered inhaler, the use of our friendly toilet paper roll, but even more importantly, that we want to have your doctor dispense you with an aero chamber or a chamber, holding chamber, so you can get that medication properly. So thank you very much.
You're very welcome.
In Ventura, we're going to be right back.